Good morning, everyone. Thank you very much for inviting me to be here today. Thank you to the All Ireland Institute for the invitation to speak at what is a very important event. I'm very pleased to be here, and I'm looking forward to hearing some of the discussions and debate, and maybe taking a few ideas back with me when I go back this afternoon. I know Regina introduced and said there was a panel of expert and interesting speakers. I'm not sure I can claim to be expert, so I shall do my best to be interesting and try and provide you with some context for work on palliative care and the focus on outcomes that we're making in Northern Ireland. So there's a couple of areas going to focus on really. One was the current programme for government in Northern Ireland and that as a driver, and secondly also talk about some of the broader changes that are happening in Northern Ireland to the way health and social care is delivered and what that means for our approach to measurement in the system and to outcomes. The programme for government for Northern Ireland currently remains in draft given the current political impasse, but it is the document to which we are working and which is driving the focus in the public sector across Northern Ireland. Officials have been working very closely with partners and stakeholders to put in place arrangements to support that vision set out in programme for government, which focuses on 14 strategic outcomes, which together are intended to set a clear direction for travel and to enable continuous improvement on key elements of societal well-being. The outcomes touch on every aspect of government, including, as you'd imagine, health, education, economic success, and creating confident and peaceful communities. As you can imagine, there's been quite a bit of effort put into developing that programme, and the focus has really been on things that will make real improvements to the quality of life for people living in Northern Ireland. The 14 outcomes that are set out in the programme for government are supported by 48 indicators, which are the statements on how we're going to deliver that change. Those 48 indicators often support more than one outcome, so there's a degree of complexity in terms of how that's delivered. The approach we've adopted in Northern Ireland builds on international learning, but particularly draws on Scotland. We've had some of our Scottish colleagues over advising and supporting us, and it's more than about a paper exercise in terms of defining the outcomes. What it's intended to drive is a change in the way that government works and a breaking down of silos and a new approach to collaboration with those outside of government, in fact. I suspect I'll get the civil service and the executive's excuses in early. I suspect we haven't got it right first time round. I'm sure the Scots would say they didn't. We probably won't get it right second term round either, but as a direction of travel, a focus on outcomes and how they're delivered, I think that will be the approach we take for a number of years to come, and I think we've got a good basis to start driving change in the way public services are delivered in Northern Ireland. Of course, outcomes-based approaches are not new in health. When I had responsibility for developing the key indicators for the health and social care system in Northern Ireland, we sought to move to a more outcome-based structure, and I'll touch on a bit later the report from Professor Raphael Bengoa on the Northern Ireland health and social care system, and Michelle O'Neill, our former minister's response to that, which is clear about the need to focus, clear about the need for the department and the regional bodies to focus less on defining the how and more on the what, freeing frontline providers to collaborate together to deliver better outcomes rather than just focusing on procedures or processes. So the draft programme for government is based on principles set out in a book by Mark Friedman called Trying Hard is Not Good Enough, which is the handbook to outcome-based accountability, or OBA. It's intended to be a kind of disciplined way of thinking to take action to actually have a real impact on the lives of people within our communities, and the evidence does seem to show that it can improve the performance of organisations, programmes and service systems. The OBA approach is based on two key things, namely, as I mentioned, identifying the outcomes that will improve the lives of our population, but also importantly ensuring that there is absolutely clear accountability for the achievement of those outcomes. What this means for us, whether we work in developing policy or service delivery, is a new way of business that takes us away from a focus on systems and processes to a stronger focus on results, and indeed changing what we do where we're not delivering those results. So OBA is intended to be a driver for change in policy and change in service delivery. Clarity of focus is important within OBA, and the starting point is a very clear agreement around what the outcomes are that you're seeking to achieve. That is, I think, easy to say, but very hard to do. My kind of limited experience so far in seeking to define outcomes within the health and social care system is that there's a lot of effort to do that and to get buy-in to them. So as with the programme for government, it looks simple to create a list of 14 outcomes, but there's a lot of debate and focus behind that. In the past, we have probably been too focused on process, focusing on things that are easy to control. But we need to recognise that the process is there for a purpose, and that the focus should always be on delivering those good results. Occasionally, we will fail in what we're seeking to do, and I think the key thing around outcome-based accountability is not continuing to do what doesn't work. Understanding what you're trying to achieve in the long term and changing the actions that you're taking to ensure that you are moving towards that goal. So that can sometimes be difficult, I think, in terms of defining what you need to do, perhaps politically, certainly financially. But I think having that very clear theory of change is what we're seeking to do. So a key sense of what we want to achieve, and then looking at the evidence about how we're going to get there, what things we need to move, the dials we need to turn to achieve that. The draft programme for government has 14 outcomes. In fact, all of them could be said to relate to health in some way, I would argue. I've picked out 4 there that are really probably most pertinent to health. We enjoy long, healthy and active lives is probably the one that most people would view as the health and social care indicator. But actually in terms of palliative care, I would say the last 2 are perhaps probably the key drivers for change within our system. The focus on caring for others and on the high quality of public services. Those outcomes will be reflected in the commissioning plan direction, which is the document the department issues to the HSC setting out its priorities, alongside some other outcomes we'll have identified, such as supporting those who care for others and increasing the level of efficiency in the system. And I guess it's one thing to say that those are the things you want to achieve. It's another thing to really identify the measures that are going to give you a sense of how you're making progress towards that. So appropriate and reliable data is critical to underpinning the OBA approach. The data is kind of important for understanding how you go forwards, but it's also important for understanding where you've got to, and what has worked and what hasn't worked so far. So there's something important about understanding the story behind the baseline in the OBA approach, and crucially where you've gone wrong in the past, what hasn't worked, so you don't repeat those failures. That's really a straightforward thing, of course. There's always a debate around what went wrong in the past and what went right in the past, but that's a key part of the OBA approach. And the focus must be, as we look forward, on seeking to turn the curve, so to change the indicators in a positive way and shift the direction of travel for the future. Those approaches are underpinned by action plans, and a number of my colleagues in the departments are responsible for action plans associated with specific indicators. And again, it's easy to develop an action plan. The key thing, as we know, is having something that you're really going to stand by and deliver, and that will have an impact, that isn't simply focused on a large number of things, but which focuses on those things that will have the most impact. The advice from the OBA experts is therefore to keep action plans simple, based on common sense, written in plain language, and using the minimum amount of paper. The other focus of an OBA is on accountability. So making a difference means knowing not only what the outcomes are that define the difference, but also where the accountability for achieving those outcomes lies. An OBA focuses on two levels of accountability. One of those is population accountability, which is where there's a focus on the well-being of population within a defined community. That can be defined in a number of ways, Northern Ireland as a whole, for instance, or a particular council area. And the second is performance accountability, so the effectiveness of the agencies that deliver services or programmes to enhance the lives of people in Northern Ireland. So OBA is really about asking some searching and challenging questions, and those might include, for instance, what are the quality of life outcomes we want for our community and the children and families who live here? What would these outcomes look like if we could see, feel and experience them? And how can we measure these how can we measure if these outcomes exist or not? Are they getting better or worse? And where are we headed if we just keep doing what we're doing? We can also ask who are the partners that have a potential role to play in doing better? What will make it better? What would turn the indicator curve? And in particular, what's the no-cost or low-cost option? And then finally, what do we propose to do? So the OBA approach looks at how we can deliver services for an identified group of users. That means identifying who those users, clients, people are, and how their lives will be affected for better or worse. So the key questions we need to ask to do that are around who are these people, how can we measure if they're better off, and who are the partners that can help us do this, what works better, and what will we propose to do. So I've summarised some of the key questions there that we need to ask ourselves. I think, as I mentioned earlier, the key thing is that the approach set out in the programme for government cannot be achieved by one government department or agency in isolation, or even by government alone. So there's much more of a focus on partnership working, reaching out beyond government, seeking to influence others and work with others to deliver the outcomes that we're seeking to achieve. So that's the OBA approach. I was also going to say a couple of things about drivers for change within the healthcare system specifically, which fit very well with the OBA approach. So we've had a couple of very important recent reviews. One of those was the report by Professor Rafael Bengoa and his team, Systems Not Structures, which again talks about a move to, perhaps similar to we heard in the Republic of Ireland, a focus on patient-centred care, a real focus on population health and delivering better value. And it talks about a move to accountable care systems who take responsibility for a population, again reflecting that OBA approach. And that requires you to develop new measures, new ways of understanding how the system's moving in the direction that you want, and greater autonomy for those delivering at the front line, in line with the cost and quality measures focused on outcomes that you set. So Professor Bengoa talks about that shift to a more devolved approach, a more strategic approach from the centre, focused on defining the outcomes with a small set of outcome-based metrics. The now former Minister for Health, Michelle O'Neill, made a response to the Bengoa report called Health and Wellbeing 2026 Delivering Together, and that is really the key framework which we're working to in health and social care in Northern Ireland at the minute for delivering change. There's a focus in there on things like co-production, again in line with the OBA approach, which talks about the need for partnership, and it looks to really transform how services are designed and delivered by breaking down silos and encouraging work across boundaries. What that means in practical terms is that we'll be moving away from the commissioning model that we've had, looking to devolve much more of the planning down to the service provider level and empower providers and communities to work together to develop integrated plans for care. Finally, on the kind of palliative care side, we've had our strategy for palliative care in Northern Ireland, Living Matters, Dying Matters, and a review by the Regulation and Quality Improvement Authority, which was positive about the progress that we've made, but suggested there was much more to do. We've sought to reform the structures that we use for driving forward the palliative care agenda in Northern Ireland, being led by the Public Health Agency and the Health and Social Care Board. And we're also starting to look much more to a public health approach to palliative care, which I think fits very well with the OBA approach. So palliative care is not a niche, it's not something just done by specialists, it's something that the wider health and social care system and indeed society needs to talk about and focus on. And I think that fits very well with the approach set out both by Michelle O'Neill and the OBA approach being taken more widely within government. So I hope that's helpful as a summary of some of the drivers for change in Northern Ireland.